morning, everyone. Welcome to our event, Navigating Women's Health, Wellness, and Advocacy. We're really happy to have you. My name is Amanda Zen. I'm the President and CEO of Leadership Baltimore County. I'd like to first just extend a very warm welcome to our distinguished panelists, our esteemed moderator, and of course, all of you, our valued attendees. I'd also like to welcome our sponsors for today's event. Can you join me in thanking Debbie Harris with BGE and Craig Carmichael with Northwest Hospital? And Craig and Debbie, if you are on, maybe you could just wave your hand so we can see who you are and acknowledge you. Okay, thank you. So for those of you who are not familiar with Leadership Baltimore County, we are a nonprofit community leadership program, and our mission is to bring together high achievers with diverse perspectives, experiences, backgrounds, industries, sectors to enhance their leadership effectiveness, educate them about the challenges and opportunities facing Baltimore County and the region, and inspire and motivate them to take on leadership roles in our community to enhance the vibrancy and the quality of life for all. And if you like, you can learn more about Leadership Baltimore County at leadbaltimore.org. So I'm going to just go over a few housekeeping protocols for you, and then I'm going to introduce our moderator, and then she's going to introduce the panelists and take it from there. So first of all, today's session is being recorded. You should know that. The recording's already on. Secondly, we have muted everyone, but you're more than welcome to turn your camera on if you wish, or you can leave it off, whatever you feel most comfortable with. We do want to hear from you. So Violet Apple, who is our moderator, will open the floor up for questions after the presentations. And what we'd like you to do is electronically raise your hand, and then we will call on you in the order of the hands being seen on screen so that you can ask your own question. So you'll need to unmute yourself to ask your question, and then we ask you to please remute yourself after you've asked your question. All right, so let's get started. It's my distinct pleasure to introduce you to our esteemed moderator, Ms. Violet M. Apple, Chief Executive Officer of the Girl Scouts of Central Maryland. A strong advocate for children, Violet has been dedicated to the development and servicing of girls for more than 30 years. In addition to her numerous accomplishments, serving several C-suite positions with the Girl Scouts here in Maryland, as well as in Massachusetts and Pennsylvania, Violet has demonstrated her commitment to the community. She is currently, or was previously, serving on numerous boards, most notably the Maryland Legal Services Corporation Board, which, by the way, is an appointment by our governor, the Maryland Nonprofits Board, CASA of Baltimore City, and the WOW, Women of the World Festival. She's a member of Delta Sigma Theta Sorority, the Executive Alliance, Baltimore Women's Advisory Board, and she's a graduate of the leadership class of 2015. Numerous awards have been bestowed upon Violet. She's been named a Most Admired CEO by the Daily Record, as well as one of the Daily Record's Maryland's Top 100 Women, not once, but twice. She's been honored with the Luminary Torchbearer Award, the Baltimore Teachers Union Women's Rights Award, the YWCA's Racial Justice Award, a Smart CEO Brava Award, and she's been inducted into the Smart CEO Circle of Excellence. Most probably important, she's probably most proud of the fact that she has received the Thanks Badge, which is the highest award given by the Girl Scouts of the USA. So Violet holds a master's degree in business administration, a bachelor's of art in social work, and a nonprofit management certificate. So Violet, thank you so much for moderating our panel today, and I'm going to turn it over to you.
Thank you so much, Amanda. You just took me on a journey through that introduction. I am very thankful. Everyone looks so serious, so I want everyone just to at least put a smile on your face. I know we're here to talk about some pretty heavy subjects, but I think first and foremost, just having a smile is really good for all of our mental health. So I'm going to get right to it because we really want to spend our time with our esteemed panel. But before we do that, I just want to kind of lay the groundwork. So again, good morning and thank you so much for being here. I especially want to thank the leadership Baltimore County for convening us and bringing forward this very timely and important topic. Today we're here to have a discussion on the impact of COVID-19's pandemic on women's health. We're going to explore ways in which to improve women's physical and mental health and how we can advocate for a more inclusive and public policy agenda that addresses these issues. Today's panel are incredible subject matter experts, and they're not only here to shine the light on the problems that we see, but they're also here to provide solutions and give us thoughts on what we should be focusing on next. Throughout the past year, I've heard, I've read, and I've been part of groups who have looked at and or studied the impact of COVID on communities, on individuals. Many of us have learned about and heard about the significant disparities that have been exacerbated by COVID-19. It wasn't like they didn't exist before, but they have been exacerbated by COVID-19 on individual groups. But little did any of us know what we were going to be faced with back in March of 2020 when we began our first sheltering in place. At that time, we heard about the challenges. The focus was really on the challenges around virtual schooling for children and parents working from home, and the challenges of everyone just being in the home all at one time. We began to see significant layoffs. There was immediate impacts on supply chain issues, and the list goes on. We heard about staggering labor statistics, and we still are hearing about that. We're hearing about, we were going through this very highly charged political landscape. Not that that's calmed down, it's still there, but it was even more charged. We had racial inequity right in front of us. And all of that was a very scary time and still continues to be. But what I think was missing is, and it started to evolve, is the impact it was taking on and having on mental health. As a professional who supports children, I personally began delving into the impact of COVID on children's mental health. I also had the privilege of working with the Greater Baltimore Women's Advisory Board, who's worked in conjunction with Towson University to study the impact of COVID on women in the workplace. There are solid presentations about that specific topic out there. Frankly, when we talk about what's happened in the workplace and we talk about labor shortages, there are intersections on the topics that we will talk about today. But I'm not the expert on that. I want our panelists to they will have an opportunity to bring that forward. So what brings us here on the 17th day of Women's Month is a topic that I don't think we've heard enough about. In some areas, I think we've actually been silent. And I want to encourage you. There are two reports. I'll drop both of those reports in the chat. One is the UN report on women. It is a powerful report. It is a report that talks about the state of women around the world. And then there's also the McKinsey report on women in the workplace. And that also sheds a lot of light on issues that have been and are affecting women. It has not been, I don't think that we have been leading. These are not been our leading headlines. But today, I am really pleased that we are here to change that. And we are here to focus on something that I think is critically important. Now, I'm going to stop talking and I'm going to turn over the morning over to three insightful and thoughtful experts who will dig deeper into the impact of COVID-19 on women, on women's health. Let's just take that in for a minute, on women's physical and mental health. Our three panelists today will each lay the groundwork in specific areas and provide critical takeaways. After the third presentation, I will come on and lead a Q&A, and we encourage you to bring forth your questions. I'm happy to present to you today. Our first presenter will be Lisa Jordan, Esquire. She is the Executive Director and Counsel for the Maryland Coalition Against Sexual Assault. Following Lisa will be Dr. Erica Martin Richards, who is the Chair of Psychiatry at Sibley Memorial Hospital. And following Dr. Richard will be Dr. Netta Gold, Director of Mindfulness Programs at Johns Hopkins Medicine. I give to you Lisa Ray, who will start off the presentations, and they will follow, and we will see you. I will be back in a few minutes. Lisa?
Good morning, everybody. Happy St. Patrick's Day and happy Women's History Month. And Violet Apple, thank you so much for that really lovely introduction. Again, I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault, and I very much appreciate the opportunity to be here. Let me just say one couple of things, I guess, about myself and about the Maryland Coalition Against Sexual Assault before we dive in. I'm a lawyer. I practiced domestic violence law for a long time. And at that time, there were no legal services for survivors of sexual violence. And so almost 20 years ago, I founded SALLY, the Sexual Assault Legal Institute, which is Ms. Apple, a MLSC grantee. Thank you for your support of that. And the Sexual Assault Legal Institute provides direct legal services for the whole state, for children and for adults, for any legal issue that's related to sexual assault. And then about 10 years, the board asked me to assume the executive director role at MCASA. And that's led me to focus more on training and collaboration and speaking to groups like yours. I really have to thank Anne-Marie Thornton and Amanda Zinn and Leadership Baltimore County for including me and for including the issue of sexual violence as we look at the effect of COVID-19 on women. And if I could have the next slide, please. Let me say that you're all welcome to contact me anytime. I invite your input and your help with our issues. I will say that right now we're in the middle of the Maryland legislative session, and that is one of the primary things that I wanted to talk to you about today, is what you can do as women interested in helping other women in the policy arena. And let me address first the specific issue of the COVID crisis. It really is creating unprecedented challenges. Sexual assault survivors report that their trauma is amplified by the quarantines, economic pressures, fears for the future, and our programs are stretched thinner every day. I think that we focus so much sometimes on survivors that we forget to also assign responsibility to the perpetrators. And let me tell you, the perpetrators are emboldened by COVID. They have had more access to children, more access to people they want to sexually exploit. They really are able to evade some of the ways that we were able to find and stop sex offenders in the past. And so COVID has really hurt survivors and helped perpetrators. And if we could go to the next slide, let's dive in and talk about some of the things that we can do to help combat some of these issues. The first thing that I need to bring to your attention is something that I think sometimes as women, we don't feel comfortable enough about talking about, and that's money. You know, often we are kind of taught a certain distaste about really diving in and fundraising and talking about financial issues. But let me be very clear that money is policy. What we spend money on, what we use our tax dollars for, that is what we care about. And what's happened is that there is a fund called the Victim of Crime Act Fund. It was established by Congress. It was funded through fines on criminals in federal cases. And there was a change in the way they were prosecuting those cases. So they went from prosecuting people to doing what's called a non-prosecution agreement. And so this fund went way, way down. And so We fixed that at the federal level through advocacy. But what we have right now is a gap in Maryland. And let me be absolutely clear, this gap threatens our domestic violence shelters, it threatens our rape crisis centers, it threatens the counseling, the therapy, the support that women need and that they need even more during the COVID-19 crisis. And if I could just have the next slide, please. So this was over 120 services providers, and look at that list of people who are helped. Survivors of rape, domestic violence, trafficking, child advocacy centers where we do child-centered interviews of children who may have been sexually abused, families of murder victims. These are also the victim witness assistants at state's attorney's offices and more. And the next slide, please. So I ask you to help us all contact the governor and ask the governor to use some of the wealth that we have in Maryland to fix this dip in VOCA funds. So this is an important takeaway from today, something concrete that you can do to help survivors. And let's be very clear that all of this there are a lot of intersections between the need for services, COVID, and the impact on people of color, of people who are of limited means. And so they are really facing the brunt of the lack of services that will come to us in October if this dip is not fixed. And if I could have the next slide, please. Again, we're looking to Governor Hogan. We have information, we need your leadership. And the next slide, please. And the next. So let's move on to policy bills. And I did want to talk about policy in kind of a broad sense, because I have some bills that you'll recognize as directly related to healthcare, but then we also have other bills that are related to healthcare, but maybe the name at the top of that bill is a little bit different. And so perhaps we're not talking about health in terms of access to therapy, but we're talking about health in terms of access to a protective order that can help you stay safe. The next slide, please. The first one I'd like to talk about is marriage as a defense to sex crime. This may be a surprise to some of you, but marriage is still a defense to some sex crimes. Again, marriage is a defense to some sex crimes. For unmarried couples, they have the full protection of our criminal laws. But for married couples, there are some sex crimes that the perpetrator can simply say, no, she's my wife. I can do whatever I want. It's way past time to fix that. So that's one bill that we're looking at this year. And the next slide, please. We're looking at body cameras and victim privacy. Part of our response to racial injustice has really been to look at policing reform, and part of that is body cameras. What we haven't always tended to well enough is that when someone comes to your door after you've been raped, after an incident of domestic violence, you may be in a situation, perhaps not closed, perhaps upset, where you don't want that image out on the internet. We need to protect those images, protect victim privacy. This doesn't affect court cases. It doesn't affect anything in court at all, but it would affect, your neighbor getting a copy of the footage just for fun. Next slide, please. Human trafficking. We need to keep our youth victims out of the criminal justice system. Right now, too often, when we have a survivor of sex trafficking, often Black and brown girls, some Black and brown boys, certainly all sorts of people caught up in sex trafficking, but we are unfortunately charging them with petty theft, with possession of marijuana, with joyriding. We need to take those low-level crimes and say, if you committed these crimes because you're a survivor of sex trafficking, we shouldn't prosecute you. We should provide services. This promotes their health. Next slide, please. Protective orders. I'm pleased to say that we have bills really very close to being passed that will allow for remote access to getting a temporary protective order. So that initial filing of the protective order. We learned during COVID that we can do this, and those judges who said, oh no, we can't, well, we've proved them wrong. And so now we want to continue that going forward. Next slide, please. There's also a bill that will update our stalking laws to prohibit electronic stalking. So this is something that, people use with their cell phones, or those little air tags you can find your bags with. Stalkers use those too. That needs to be part of our law, that's forbidden. And the next slide, please. Rape kits, we're improving our response on rape kits. And in particular, we're going to have something directly related to kind of traditional healthcare. We want to prevent HIV infection for rape survivors, and we need the state to provide that medication free of cost. And so that bill also is moving right along to continue a pilot program that's already in place. Next slide, please. Abortion access is absolutely critical for women's health care. About 3 million women are survivors of rape-related pregnancy, survivors of rape and then became pregnant as a result. And for women between the ages of 12 and 45 who are raped, about 5% of them become pregnant. So we want to make sure that these survivors have access to the reproductive choices that they need. Next slide, please. Sexting, we've got a bill that will educate children about sexting and the dangers of sexting, because sexting often is the way child pornographers are getting their content, right? And this electronic communication is something that, of course, has increased during the pandemic, so it's become even more critical. We're almost there. Next, please. How can you all improve policy? The next slide, please. I ask everyone to do 3 things every legislative session. We are on day 25 of the legislative session. You still have 24 more days to act, and they can be 3 things you choose. They can be emails, phone calls. You can visit Annapolis now. You can testify. You can get involved in all of these issues, and these are practical, concrete things that everyone can help with. Next slide, please. Please remember to vote. Remember, our primary has now been moved to July. So be sure you get those absentee ballots in if you're going to be on vacation, and go out and vote if you're in town. Next slide, please. And the main thing I really want to convey to all of you is to speak up and speak out. It is critical for our health, for our wellness, that we continue to talk, that we continue to support each other and all women, in order to increase our health, in order to respond to COVID, in order to continue to fight against racial injustice and correct many of the wrongs in the past in our society. And that not only speak up, speak out, but let me also just suggest that many of you on this call, you are leadership Baltimore County. Please also think about running for office. We need women in those seats. I believe that's the end of my presentation. Thank you all for your attention. I look forward to the questions and answers.
Thank you so much.
I think I'm up.
You are Dr. Richards.
So I'm Erica Richards. I'm the chair of psychiatry at Sibley Memorial Hospital, which is a community hospital, one of the Hopkins community hospitals located in Washington, D.C. I want to give my Baltimore credibility. So I have spent time in Baltimore as well. I did my MD and my PhD, so my medical and research training at the University of Maryland School of Medicine. And then I did my residency in psychiatry at Johns Hopkins. So I spent a lot of time in Baltimore before moving back to the DC area where I'm originally from. I have a specific interest in a lot of kind of different aspects of mental health. 2 that I'll highlight. One is related to peripartum, postpartum mood disorders, because I think it's relevant today. We talk a lot about kind of the baby blues and postpartum depression. On a broader scale, certainly, which is relevant during COVID, I am not going to highlight that today, only to say that I think that that's a special kind of niche that a lot of women are now starting to seek additional help. And so I think it's important to continue that conversation. I also have an interest in increasing access to mental health care for underrepresented minorities, including participation in research, because I think that getting those answers a lot of times at the research level is also really important for advancing our knowledge and our ability to reach into different communities and not only encourage them to seek help, but actually have help that is relevant and culturally sensitive that people are willing to accept. So with that, I do want to talk about mental health awareness during COVID-19. It's going to kind of just be a brief overview to make sure that we're still all on the same page for the rest of the discussion. Happy to answer additional questions that I'm not able to highlight in the time that I have right now. But first, when we talk about mental illness, I want to kind of indicate that this is really an umbrella that has a lot of different things underneath. When we talk about mental illness, yes, people will say depression, anxiety, bipolar. There's a lot of other things that fit under that. We can talk about psychotic disorders, talk about some personality vulnerabilities that people may have, sometimes called personality disorders, that also shape who we are and how we interact with our community. We can talk about substance-related disorders. We've noticed that, at least at the beginning of the pandemic, some issues with increased use of substances arose with certain populations also, certainly cognitive and developmental disorders as well. So there's a large subset of things that we certainly want to discuss when we talk about mental health. Let's talk a little bit about depression. I will highlight depression, which certainly falls under a mood disorder category. A lot of times we'll talk about mood and anxiety disorders, but for depression specifically, we're talking about, they're more than just a bad day. We're talking about symptoms that may include changes in sleep. It can include increased sleep, people that are sleeping all day, or people that can't sleep at all. They're up all night, they're pacing because they just can't settle. Talk about decreased interest in certain things. Do you usually go out and walk? Do you usually enjoy going out to see friends and you just don't want to do those things anymore? Guilt. A lot of women on the call, we talk about guilt related to, I'm a bad daughter, I'm a bad parent, I'm a bad, person at work, I'm letting my team down. All of those things that we tend to sometimes ruminate about, those, again, none of these in isolation, but when you have a constellation of symptoms that includes these things, we just want you to consider reaching out and talking to people about whether or not this could fit under depression. Loss of energy, changes in concentration, changes in appetite. Psychomotor changes, a big word, but really what it means is that some people are still. At its most severe, we call this catatonia, where people really cannot get out of bed. They're not getting out of bed to eat. They're not getting out of bed to kind of do what we call activities of daily living, showering, brushing your teeth, those sorts of things. And on the flip side, sometimes people get increasingly agitated. They're moving around, they can't sit down. They sit down for a second and they bounce back up and they're walking around and doing other things. So those would be the changes in kind of your physical motor capabilities that we see a lot. And then thoughts of suicide, which warrant a separate discussion altogether. But those are kind of the symptoms that we highlight a lot of times when we're talking about how we diagnose depression. And as I said before, as an original artwork by Annie Lee, and it's called Blue Monday. And I want to highlight that, depression is more than the blues. You're allowed to have a bad day. With COVID, you were allowed to have more than the usual number of bad days, right? You get up on Monday, the weekend's over. This is how a lot of people may feel, but then it goes away. You're able to be productive at work. You're able to have interactions. You're able to do something that you typically like and still get joy out of that. And so those are the kinds of things that we're talking about, not a bad Monday. Let's talk about depression in women for a second. So women are 2 to 3 times more likely to experience depression or a major depressive episode in their lifetime compared to men. So it's really important that we know the signs and how to seek help. Certainly there are ages where this is most common, 25 to 44, but we can diagnose it much younger than that. We can diagnose it in pediatric adolescent populations. We can also diagnose it for the first time in geriatric populations. So talking about 60s, 70s, 80-year-old people that are having their first episode. So really important to understand that it does run the gamut. And certainly there's increased risk of substance abuse and more frequent episodes in women compared to men during their lifetime. I'm not going to talk about this slide in much detail, but only to say there are different points in our lifetime where we have different risk factors that may predispose us to depression, also protective factors. So we can talk about, in young adult and adolescent populations, there may be stressful life events, and that will kind of shape how we see the world, how we interact with others. And as we get to, our 50s, there may be more instances of medical illnesses that can also affect our mood sometimes. In addition to that, the lower part of this slide talks about protective factors. What are things that we can do? It's education, it's getting a job, it's mastering a skill. All of those things are certainly some of the things that protect us from potentially developing depression or having additional episodes in the future. I talked a lot about depression. I can also speak about anxiety, but realizing that we see a lot of times depression and anxiety on this spectrum. And the good news is we won't spend a lot of time talking about treatments, but a lot of times the long-term treatments for depression and anxiety are the same. We talk about SSRIs, or selective serotonin reuptake inhibitors, as being one of the main categories of medications. And that's because it can target a lot of these symptoms, some specific to depression in the red, some specific to anxiety in the blue, but really an overlap that we see with both diagnoses as well. What influences our mental health? Well, we have to remember, certainly physical health matters, our relationships, how we interact with others. Certainly financial stressors have become an issue during COVID. Are we doing meaningful things that at the end of the day allow us to rest, allow us to feel good about our day? And I highlighted discrimination as one of these that we've talked about, kind of racial and social justice and the movement towards that. Well, the COVID pandemic hit an intersection with the social justice demands, but a lot of people felt that they were stuck. They wanted to go out, they wanted to participate in a meaningful way in the discussion and the protest, but they also didn't want to catch COVID. And so that was an additional stressor that I think a lot of people experienced during this same time period as well. So the pandemic was one factor, but there are a lot of other factors that also affected mental health. When we talk about COVID, I do think we are on the upswing, everybody. I think that the end is in sight. Will we return to normal as we knew it before COVID? I think there'll be some changes. But what we're seeing now is, this is a slide that highlighted where we were even a year ago, 6 months ago even, with isolation, loss of identity. Wait, I go to work every day, but now I don't. I stay at home and go to my office at home. And so I've lost part of that identity. More dependence on others, especially for our aging populations that were afraid to go grocery shopping, that didn't know how to work sometimes. The social and technology necessary to order groceries. So more dependence on others, loss of friends and family. Some people were not taking the precautions that we thought were necessary. And so we just stopped talking to them. And so how do we now start to right some of those things? We certainly saw increased anxiety and lack of ability to engage in self-care. People weren't getting nails done. They weren't getting hair done. They weren't even actually going out for walks with friends anymore because they were scared. So we weren't doing the things to right the ship anymore. I'm going to move through these a bit quicker, but this was a CDC pulse survey. So something sent out by the CDC that just says, where are we? Where are we in households? How are we doing? How are individual households doing with anxiety and depression and that sort of thing? And in the yellow, we can see in 2019, prior to the pandemic, of course, anxiety and depression is present in society. It was there. But we saw about a 4-fold increase when that same survey was sent out in July of 2020 during the pandemic. So if you were feeling low mood, if you were feeling more worry, if you were more anxious, you are certainly not alone. This is a division by age. Again, it seemed to hit all age groups with some exception in the 80+. I'm gonna hold on treatment options. I mentioned a few. Dr. Gould is next, and she'll be highlighting some other things, but certainly there's therapy, there's medications, there's both where we see most of the improvement, and then there's other procedures as well. I'm going to hold on strategies to improve your mental health because we can certainly talk about that during more of the discussion. And I'm going to stop there so that we have enough time to actually have the panel discussions and questions. Thanks for your time.
Thank you so much. Excellent. Okay, we're going to move on next to Dr. Gould.
Okay, let me share my slides here. Well, welcome everyone, and thank you to my co-panelists for their excellent presentations on very, very important topics. I'm a clinical psychologist at Johns Hopkins, and I have a couple of roles or areas of kind of interest and passion there. And one is I work with adults with anxiety and depression in an outpatient clinic and provide cognitive behavioral therapy. And also, one of my primary passions is providing mindfulness and mindfulness-based stress reduction courses to patients who come to me from all different places in the hospital setting and outpatient referrals, but also to provide mindfulness courses to faculty and staff and employees to address stress and burnout. And so today I'm going to just touch on these two areas so you can walk away with a few tools, a few resources. Certainly this won't be an exhaustive presentation, but we'll give you a little bit of an idea of what to look for and some tools you may be able to use. Okay. So I'm going to start with mindfulness, spend a few minutes on mindfulness, then I'll shift to cognitive behavioral therapy. Mindfulness is something really near and dear to my heart. I was introduced to it when I was doing my postdoctoral fellowship, and it really, really resonated with me, this idea of living in the present moment. It had not occurred to me that people lived in the present moment. I was always thinking about the future or the past, and realized that this is a skill that some people already have, but others, such as myself, could learn. It's the ability to pay attention to the present moment without judgment. So when we're stressed, our mind tends to get caught up in the future or the past. And mindfulness is the ability to come back to the present. And we can practice the skill theoretically in every moment. So we can, many people often think of mindfulness meditation as, sitting somewhere and bringing attention to your breath. And that's kind of a formal mindfulness practice. And then informally, we can just notice what we're doing when we're doing it. So if you're sitting here right now and checking your phone or on the news or thinking about the million things you could be doing or should be doing, see if you can come back to this moment, because you're here anywhere. You're sitting here anyway. And so it becomes stressful when we actually are trying to think about something else when we're engaged in another activity. There's lots of science behind the benefits of mindfulness. Some of the most kind of consistent and robust findings are that we see with regular mindfulness meditation practice, we see decreased stress, improvements in anxiety and depression, decreased physical pain, increased resilience to deal with kind of challenges in life and bounce back, and an increased ability to tolerate discomfort and uncertainty. And certainly we need that these days with all of the discomfort and uncertainty. So I'm going to touch on just a couple of tools that you can start using today in terms of mindfulness. So coming back to our senses are always in the present moment. Our thoughts are not always in the present moment. So anytime you notice you're starting to feel stressed, just come back, notice things you see, feel, hear, smell, and taste. You're already grounding yourself back into this moment, getting a little bit of distance from those thoughts that can be distressing. There are many different types of breathing exercises. You already know how to breathe. This is just one mechanism that's easy to remember, square breathing. If you want to take a couple of minutes in the morning, a couple of minutes in the evening, just take a few deep breaths, hold them, and release. This is an easy way to remember it because you can envision that you're drawing a square with your breathing. My favorite tool is to drop the story when you're stressed. State the facts of an event. For example, I was in just a few minutes ago, I got kicked out of the Zoom. That's the fact. I just got kicked out of the Zoom. The story is, or the add-on thoughts, what if I can't get back in? Oh my gosh, this is a problem with my internet and nobody else's. And what if people are trying to contact me and I don't know? So those are all stories that already make a stressful situation so much worse. I can let those go and say, I just got kicked out of Zoom, focus on getting back in, which I was able to do. There are tons of mindfulness resources out there. I've listed just a few apps, a few websites, but if you just Google, mindfulness meditation, thousands of things will come up and you can just play around and see what fits for you. Calm, Headspace, Insight Timer are just some of the most popular apps if you're looking to use an app. So let me just shift over to cognitive behavioral therapy, and I'm zipping through these topics that I normally could spend hours speaking about because I just want to touch on them and have be able to get to the rest of the panel discussions. Cognitive behavioral therapy is an evidence-based treatment that can be incredibly effective. Dr. Richards alluded to it. It can be effective on its own in some cases, often in moderate to severe cases of anxiety, depression, other ailments. Cognitive behavioral therapy and medication are most effective. This is a short-term type of therapy where we focus on the present moment and have a problem-solving approach. It's interactive with a therapist, and you have homework assignments where you work towards goals. It's evidence-based for so many diagnoses. There's so many research, and it's been modified to, for all of these different psychiatric ailments that Dr. Richards alluded to at the beginning of her presentation. And the premise behind it is that our thoughts and feelings and behaviors are interrelated. And so what we think affects how we feel, which affects what we do. What we do affects our thoughts and how we feel. And so we intervene in the area of the thoughts and the behaviors. So in a cognitive behavioral therapist would help you address behaviors that are unhelpful and increase behaviors that could be helpful. And also address thoughts that aren't really useful. Those thoughts, Dr. Richards mentioned, I'm a terrible mother or child or whatever, thoughts that everything's going to turn out horribly in the future. We're going to address those thoughts and see how realistic and helpful are those, and are there other ways to think about those thoughts. And by changing these two areas, we change how we feel, whether it's depression, anxiety, or some other issue. So this is my final slide. I just wanted to put a few resources up. These are cognitive behavioral resources, places you could begin to look to find a therapist. I put contact your insurance plan as the last thing, because many people are contacting their insurance plans and finding out that providers aren't accepting new patients in their plans, even though it says they accept new patients. And so these other resources have broader lists of individuals you can search for beyond just your insurance. They may or may not take insurance, but oftentimes you can search with that as well. So it is challenging to find mental health care, but I'm hoping that these are places that individuals could begin. So thank you so much. I know I zipped through that, but can answer questions in the discussion as well.
These 3 presentations were just outstanding. And I'm glad, Dr. Gold, you talked about coming back to the moment, because my mind was racing. I was already off the rails thinking about all kinds of things, and I needed to be centered and brought back. So I really, really appreciate that. And so I want to start off with a question. I know we had a list of questions we were going to go through. I'm not going to start at the beginning. I'm going to start with a question. It has me thinking. Could any of you talk about how the delivery of care and access to care and resources to care have changed since the pandemic? And what are some of the resources that are available specifically to women and girls to gain access to treatment? I think, Dr. Gold, you just said a minute ago that sometimes care is limited. So I would love to hear any of you talk a little bit more about how that has changed, if it's good, bad, or what are some of the ways that we could access.
Sure, I'm happy to kind of follow up on just some of the comments I made and then give it to the other presenters as well. I think that the one thing the pandemic has done is really made us reevaluate our mental health system, and we've really noticed the gaps in it. We are beginning to address those gaps, which is wonderful, but we recognize that we need a lot more than we have. I think the positive that's come out of this pandemic is that we've had increased access to telehealth services. And so we're accessing a population and individuals who may not otherwise have been able to get the help they need. And another positive is that mental health is becoming a little bit less stigmatized because people are coming forth and saying, no, I have these issues and I can't hide them anymore. And everyone is having these issues. We're not alone. So care is becoming a little bit more accessible and less stigmatized, but we still have so many gaps that we do need to address.
Great. Dr. Richards, do you have anything you would like to add to that? Or?
Yeah, I have. So I agree with Dr. Gould, because the one kind of example I'll highlight that I've spoken about is kind of perinatal postpartum care, and anyone, and I will contrast that, or in addition, similarly, anyone that's had to take a young baby out of the house to get to something on time, or an elderly family member out of the house to get to something on time. It is overwhelming. And so what we were able to do with telehealth is to say, okay, you're struggling with postpartum depression, you're alone, you don't have the normal people that would come because it's a pandemic. But the good news is all you need is an iPhone or a computer, and we can have our session. I can still see you, we can do these things. So no longer a need to worry about, do I have to pump before I leave? Do I have to, what if baby's asleep? What if there's no one to help me get them dressed and get them, and then I have to park and I don't even know how to open this stroller yet because I'm a new mom. So all of those things actually went away with the pandemic, and we were able to provide more services with people in their homes. And that in itself was less anxiety provoking for women, especially. The same thing with people trying to get elderly family members to an appointment. I mean, now sometimes with Zoom, they can still have the care provider put the person or put the loved one on the appointment. They can still be at work, or they can be in their homes on a similar Zoom chat. So it really has helped us provide access to people that otherwise would be 10 times more anxious by the time they get to us, just from trying to come and get the help. And so it's exciting from that perspective. I know there's some specialties that we're not able to do that. Of course, with the breast exam, we have to go in and get a breast exam. That's not going to change. But even having some of those discussions or some of those follow-up appointments, I suspect those will remain virtual. And I think that's one good change that's happened with healthcare. The same would be true with who I can treat and where I can treat them. Now that I'm licensed in multiple states, then I'm able to treat the college student that went home for winter break and had an issue, because now I can see them in that state. So there's a lot of good things that have come out of it.
Lisa, what about access to reporting or any of the things that you talked about in regards to sexual assault? Have you seen any significant changes because of the pandemic and access?
Yeah, absolutely. And very similar to my co-panelists, many of the services that were provided by rape crisis centers, or access to services that used to require an in-person visit of some sort, have changed. And really the pandemic was what removed some of those barriers, where we had people who were like, oh no, I couldn't possibly do this online. We can't figure out the confidentiality. We can't do all of this. All of that's gone away. And we're in this process right now of figuring out how to go forward. I'm so proud of the rape crisis centers across the state. In Baltimore County, you've got Turnaround Inc. that provides those services, and everybody just, in March of 2020, they went from all of this in-person service to virtual services pretty much overnight. And they're continuing to provide virtual service. And now we're grappling with, how do we address the survivors, the people who want to come in and have group therapy, individual therapy in person? How do we accommodate them? And how do we continue to have virtual services? In terms of reporting to police and the courts, definitely it's more online. I have to say the law enforcement system is a bit more resistant than our fabulous mental health providers. So we still struggle with law enforcement kind of insisting on some very in-person conversations. And the courts really pushed back on the bill that I mentioned, saying that we would be able to file for a protective order. So ask the courts for help, not do the hearing, just ask them for help remotely. But the legislature pushed back, and people will be able to go to the hospital and file for the request for a protective order there. They'll be able to go to a rape crisis center, go to a domestic violence shelter and file there. So I would say that it's slower in the court and judicial system and the law enforcement system, but they're definitely moving in that direction. I think the other thing I do want to just touch on is that people are facing enormous workforce pressures. And I think one of my colleagues alluded to, we've seen the gaps. Well, the gaps are extreme in terms of workforce. We already were facing an enormous gap in our nursing staff, so forensic nurse examiners and other nurses, but now we're really seeing that with therapists as well. And so really at our nonprofit system, we are finding private practitioners coming in and poaching staff and luring them away because they can pay so much more in the private system. And this is really a crisis in the overall structure in Maryland.
Wow. I want to follow up, Lisa, on something that you said during your presentation. This is just something that struck me. You spoke about women between the ages of 12 and 45 who become pregnant as a result of, I think, sexual assault. Mm-hmm. So I zeroed in on women at 12. How is that? Is that commonplace to think of a 12-year-old as a woman? And if so, how does that change the narrative around abuse? It's a child versus a woman. So I'm just curious to know if there's conversation or if you see a difference from that perspective. And of course, I'm being selfish because I'm a youth provider of services. So I just wanted to get your thoughts more around that.
Yeah, no, I think that's an interesting question. And I was really quoting from a study. I do not think of 12-year-olds as women. I am right with you. I think there's a reason we have the word adolescence in our vocabulary. And there's a reason that we have the word youth in our vocabulary. And I do think that the younger rape survivors really do present in a very different way. I think the other really tragic thing about that particular statistic, that 5% of rape survivors between the ages of 12 and 45, is that most of those survivors who become pregnant are adolescents. And that's because the older women who are women tend to be on birth control or know to take emergency contraception or take some sort of precaution to prevent the pregnancy. So when we look at the incidence of rape-related pregnancy, it is almost always, these adolescents that we're looking at. So it's hugely important that we address those youth and that we talk to youth. I think I know I've worked with a number of young women or girls, and they don't even realize they're pregnant. Because they don't have regular menstrual cycles yet. They don't have that experience with their body yet to understand what's going on. So we really have education to do as well.
Great, thank you. I'd like to follow up with Dr. Richards and Dr. Gould and just talk a little bit more about, I think particularly Dr. Richards, you didn't go over a slide that you had that was speaking more specifics to things that we could do to look for just better health, better mental health. And I was wondering if you could talk a little bit more about that.
Yeah, so there's a lot of things now that we can do that are even different than, during the height of the pandemic. But I think some of the things that we adopted are important. So I'm sure I'm not alone. When you would walk out the door during the pandemic, everybody was walking, everybody was running, everybody was doing some sort of exercise because we had all this time. We weren't running around from this activity to that presentation to that work function. And so we started to highlight the importance of our own health. And we did that because we needed to feel busy. And then we realized that it was probably helping us sleep better, practice more of kind of the therapeutic interventions that we needed. So continue some of those things, exercise, checking on your neighbors, just going out and seeing if they need anything. It's not only helpful for them, but it makes you also feel helpful, which then in turn really does impact our own mental health as well. Now I would shift that discussion a bit to say, and now you got to get out. Right? Some of us were following rules to the max. We were not going anywhere. We weren't doing anything social. We were doing what we were supposed to do based on the recommendations that you believed in and read and that sort of thing. But now it's time to actually test the water a little bit. And so go to functions. Certainly we still have to remain safe. Go to functions, wear your mask if you're not comfortable taking it off yet. Go to an outdoor function first, but start to do those things. Start to volunteer again if that's something that you like to do before. Ask a couple of friends to go out, but it's important now that we start to do that. And the bigger picture is, if you're seeing more anxiety, more depression, more mood symptoms that are not getting better, then it's time to actually reach out to help. And people say, well, who should I reach out to? Certainly you can always start with a trusted primary care provider. A lot of women actually will favor going to OBGYNs for their checkups more than a primary care doctor. They have a lot of resources that you can use, or they can reassure, reinforce, that's okay, here's the intervention, or here's what you need to do. So it's important to reach out and talk to someone too.
Great, fantastic. Dr. Gold, did you have anything you wanted to add?
Yes, I of course agree with everything Dr. Richards said. And what I'll add as a cognitive behavioral therapist is, sometimes we need to start small and build. So, I was one of those people where at the beginning of the pandemic, I was out and running and I can do this. This is okay. And that didn't last very long. And now I just, am a lot more sedentary. And so building back up, start with small steps, set reasonable goals for yourself and build from there, and really have some self-compassion. I think that we can be so hard on ourselves, and it's been really challenging, a really challenging couple of years for most people in some capacity, is to see if you can bring some kindness to yourself as you reintroduce activities into your daily life.
I love that you said that. I do think sometimes with women, we don't have enough of a selfishness factor, looking at ourselves and prioritizing ourselves in terms of being able to think that, I need to do this for myself. But as I've been listening to you talk, what I'm reminded about is if we don't take care of ourselves, it's hard to be healthy and ready to support anyone else in our families or our jobs or anything else in our lives. So I really appreciate that. We do have a hand up, and I'd like to open it up and go to Christina Fitz for a question that she has.
Thank you, Violet, and good morning to everyone, and thank you for this very informative discussion. I am Christina Fitz, and I'm the owner and operator of a senior care facility, specifically assisted living. And during the pandemic, I had 5 residents, all between the ages of 80 and 100, and all women. And I noticed that the job of trying to keep them uplifted and engaged was extremely tiring and grueling on me and my female staff. So I think that in our efforts to try to maintain the high spirits and combat the isolation was very challenging, but then I saw it equally more challenging with individuals who were suffering from early onset dementia and other, diseases that plague the elderly. So I looked at that chart, Dr. Richards, that you did, and it looked like that segment wasn't impacted as much. And I'm not sure if I looked at the graph correctly, but I know that for a fact, it was very grueling. And but the power of touch, they needed to have their hands held, maybe their shoulder, lightly massaged, and just really being engaged. And it helped so much. But the time and effort it did take on the staff was equally. So I do get what you're saying about the caregiver syndrome and how that impacts people that are dealing with the elderly. Not so much a question as just a comment or an observation.
Well, I'll comment back because I think it's a great observation. When things first started, the messaging was almost stay away from the elderly. They can die from this. Don't give it to them. You don't want to be the one. And so, right, what we know is that human touch, human interaction matters. And so in an effort to keep them safe, we just kind of shut them in. But that's the opposite of what we recommend for the population that you're talking about. We want people that have, that are starting to really develop forgetfulness or concerns for dementia. We want them to have interaction. We want them to just sit and see the interactions of loved ones around them. We want them to be involved. We want them to stay busy. We want them to exercise their minds. And so, there was no playbook. There will be many that come out of the pandemic, but when this started, we did not have a lot of guidance about what to do. But that's one of the things that we saw, which is certainly we shutting out and leaving people alone and isolated is also not the right answer. And coming up with ways to do that moving forward is going to be important. Similarly, caregiver burnout is a real thing. And so if you are providing care for loved ones that need a lot of assistance, you still have to find those times for your own kind of self-care as well.
Is there any other questions? If so, just remember to raise your hand and I will recognize you. I do see another hand. I think that is Imani.
Thank you. Good morning, ladies. Thank you for your presentation. My name is Imani. It seems you all work with someone who's going through a transition in life, just had a baby, depressed, experienced sexual abuse. What piece of advice do you have for someone to rebuild their identity? And maybe you've already touched on it, but what solid advice for someone they want to start their identity over?
That's a big question, an important one. I would say if someone came to me and asked that question, I would say, what does that mean? Okay, how would you define rebuilding your identity? Is it things you used to do that you'd like to reintegrate, or is it new things? And then, work together to break that down into smaller tasks, and then work with that person to see what's feasible and what's not, and work towards those goals. And so that's kind of how I would work in that space if someone came and said, I want to kind of reinvent my identity.
Does that help you at all? Or do you want to, Imani? Or
Yes, thank you. Yeah, I'm actually thinking from the point of perspective of the clients that you say you work with, like someone who's just sexually abused. I just wonder, what piece of advice do you give for someone in that stage? So yes, breaking it down to smaller steps, that does help. Thank you.
Excellent. Thank you. I'm sitting here and we've said these words a few times, and I was listening to television the other day, and I'm hearing a lot of us are talking about coming out of the COVID-19 pandemic, or it's now behind us. And I'm just curious as to, from our panelists, what is there anything that kind of worries you that we might revert back to, or that might get lost as we move forward? Because I think it feels like we're so desperate to put this behind us, and I'm desperate to put it behind us. But I'm just curious from your perspective. Are there things that we should keep our hands on the pulse? And I know Lisa has been talking a lot about that, but it's a lot that this is almost like it's over. And is it over? I'm just thinking about the lagging effects of COVID. So love to hear from all of you, but I think Lisa unmuted and may have something that she wants to share.
Yeah, no, thank you for that question, Violet. I think that's something that all of us need to think about. And I think that many of the folks on this call are women who are running small businesses or small departments, or they're in leadership places. And this is a conversation I have with my staff all of the time. It's kind of like, what are we going to do? How are we going to regroup? And I think it's really important that we not simply say, okay, everything's normal, we're back to the way we were, and just jettison everything that we've learned. And the fear I hear from my staff is often that, you know, we're going to find out we have to go back to the office 5 days a week, 40 hours a week, you know, tomorrow. And just needing to say that repeatedly, that no, we're not going back to that. We're going to continue to take what we've learned from the pandemic, which includes more flexibility and more working at home and more, you know, kind of ability to control your schedule when you can. You know, the work that I do, that my office does, there are things like this event this morning, you know, I couldn't say to Anne Marie, okay, you know, like I'm going to do that at noon. Okay. Like we had to be here at a certain time. And there are those things, but there are whole swaths of people's days that they could do whenever they need to. And my managing attorney has lunch often with her kid, and that's such a fabulous thing. And we want to make sure she can hang on to that. And I think that as leaders in the workplace, we really need to continue to push for that we're going to keep the flexibility that often women need because they're caretakers and because they have all of these home-based responsibilities. So I think that's part of what we're looking at. And I'm really curious to hear what my colleagues in the healthcare setting say as well, because I guess I really don't believe that this is over, and partly because I just had 3 staff members have COVID within the past month, right? And so they're young people, everybody under 35. So I'm very skeptical about this. Oh, it's safe. I think it might be safer, but I think that it's not at a place yet where we can just drop all of our masks and drop all of our precautions.
Thank you. Dr. Gould, do you have anything to add to that? Or
I think, you know, the one thing I would just add from a mental health perspective is that sometimes in the face of a crisis, we can hold it together, and then afterwards we realize the consequences of having been in that high stress mode. And so just recognizing to keep on top of your mental health, and just because people are out and about and seemingly leading normal lives, still checking in with yourself and seeing what you need from a mental health perspective and checking in with others as well.
Okay. Are there any other, I think there's another hand up. I'd like to recognize Camille.
Hi, can you hear me okay?
Yes.
So yeah, I just wanted to speak in general terms, maybe a comment about where we are with COVID and are things safe. And I guess I just wanted to share a little bit about my experience. So I'm a hospital medicine provider. I work with COVID patients in the hospital. Some of the sickest patients who end up in the hospital, most people who have COVID never have to go to the hospital. But for me, you know, it's been most helpful to stay present. So even at the very beginning of the pandemic, when as a leader of my group, I was the first one on the COVID unit when we really didn't know what it was, you know, it really was helpful to stay in the moment, putting on the protective gear, going in to see the patient, being mindful about what I was doing each step. And I think I'm sharing the same sort of advice or suggestion for my 3 kids, you know, as they went back to school, as we navigate this whole space that none of us have ever been in before. It's just, you know, where am I? How am I in this moment? What can I enjoy in this moment? Because I don't think anybody knows, you know, 6 months from now, where will we be? Is there going to be another surge, or isn't there, you know, is there not? But for me, just being present, enjoying what I have to enjoy, being safe in whatever way I can. Mentally safe does mean that I'm going out and enjoying some time with the people that I love, and then physically safe when I can. I do think that that's the best any of us can do.
Thank you. Thank you, Camille. It's interesting because one of our panelists, I'm not sure who said this earlier, but they were talking about the impact of the labor shortages and how that is now affecting other areas of being able to find enough staff, whether it's therapists, whether it's doctors. And we all know that COVID has had an incredible impact on frontline healthcare professionals. And so could you talk about what that means a little bit more from a mental health and a physical health perspective in terms of things that we need to be cognizant of or push forward? So any of the panelists, it is concerning because I wasn't really thinking about labor shortages as they would affect the health of women, whether it was mental or physical health, and not just women. I understand that we're talking about all individuals, but today we're focusing in on women. So I'd like for you to talk a little bit more about that and any of the panelists.
Sure. So Lise made the initial comment about that, but I'll highlight what Camille just brought in as well, which is that was a scary time. I mean, it was being on the front lines during the initial part of this pandemic and thank you, Camille, for doing that and going in, it took a lot of courage. And so we saw some people that left the field altogether. We saw some people that were nearing retirement age, which meant they were also around the age that seemed to be doing worse if they caught COVID and they went forward with retirement. We saw people saying, well, if the nursing students and the social work students and the med students aren't even going to be in, or maybe not even allowed to train, I'm going to hold off and maybe not apply yet. So there are a lot of things that were happening at once. Similarly, and not to get into all of the weeds about kind of healthcare employment, but similarly, there's a lot of people that were said, I understand, or I don't worry about taking this to my elderly parents, or I live alone, or that sort of thing. So I'm going to travel, and I'm going to travel for whatever hospital is willing to pay me the most money. And so there was just a shift of people that wanted to kind of, move for various reasons. And that became very difficult to sustain the same workforce in not only hospital settings, but to Lisa's point, in all settings where kind of that expertise is needed. Coupled with, and I see a lot of people on this call in either home offices or at work, coupled with the fact that a lot of people said, well, if I can do something from home and I don't have to commute and I don't have to, spend a lot of money on wardrobe and all of that, then I want to choose what I can that allows more flexibility for my own time. So I don't know where things are going to land, but I think it's important that we find ways to still care for our sickest populations. And I think that's what we're talking about kind of on this meeting today.
Fantastic, thank you. I do see another hand. Jackie, I'm going to recognize Jackie, please.
Hi, everyone. I've enjoyed the conversation very much. I have a question for the panel about anger. Yesterday, I was in a physician's office, and there was a gentleman that was very agitated. And the peanut gallery where I was sitting said, "Oh, he's an anti-vaxxer," and it affected me. It made me think we're putting people into groups, and I felt uncomfortable with that, and I wanted to say something to balance it out, but I could tell that people immediately, and it had nothing to do with COVID. He was upset about a bill or something, and they immediately became angry and agitated. And I wonder how we who deal with our children and elderly family members and coworkers, how do we manage that anger and that categorizing of people based on COVID and people's opinions? I hope that's a clear question. Thank you.
Yeah, thank you, Jackie. I'm happy to begin a discussion on that. People are really short fused. I think that for many people, their tanks are empty. There's nothing left. And so we're on we're on edge. And then when there's a trigger, such as, a problem with a bill in this particular case, then people don't have the resources, internal resources to kind of cope with that in a healthy way. From my perspective, how to deal with some of the anger, I have found any type of self-care, especially some of the mindfulness practices, can be really helpful. So taking some time for yourself, taking 5 minutes to do some breathing exercises. In situations like that, when I feel triggered, there's an acronym that I heard on a meditation retreat that really stuck with me, that I bring to mind anytime I'm in a challenging situation. And that acronym was King Tut. And it stands for, can you make your speech, what you're going to say, kind, truthful, useful, and timely? Okay, King Tut, kind, truthful, useful, K-Tut, basically, kind, truthful, useful, and timely. And I bring that to mind, and I'll say, is what I'm going to say meet those categories? And if not, the criteria, and if not, I just pause. Now, most other people aren't going to have that acronym in mind or have these tools in mind when they're, bursting out in anger, and that's not something you can control. But you can say to yourself, if someone is coming at you with anger, instead of turning on your fight or flight response, you can diffuse that situation by saying to yourself, this person is suffering. Okay. Anger is coming from a place of suffering, that there's some vulnerability underneath that's not being addressed. And so I'll often say to myself, this person is suffering, and that turns that anger and frustration to empathy at times for me. In terms of that categorization of people, it's hard. We're always judging. We're always putting people in categories. But I think that one thing you can do is start noticing the judging and say, oh, how interesting that I categorize this person and I'm judging them and kind of thinking this about them. Let me come back and see, can I look at this from a different perspective, knowing that they're human too, and they're struggling. They have their own struggles. And so really for me, empathy and trying to put myself in those person's shoes and find common humanity. And mindfulness has really helped me do that, because I can pause and drop some of the judgments and stories that preclude me from looking at people as humans.
Thank you. We have 10 more minutes, and I know that there's a question in the chat. Katie Wolf asked. I'd love for her to come forward and ask her question so that we make sure that it's clear. And then I want to have our panelists each have 1 minute to go around and kind of wrap up anything messages that they would like to leave us with. So think of your most powerful, hard-hitting message that when we walk out the door, give us our call to action before we wrap up. So Katie, are you unmuted that you can ask?
Yeah, thanks for calling that out. And this is just such a fascinating kind of get together. So I really appreciate it. From an employer point of view, we really are having a hard time reaching out to people and having them take actions upon themselves to take care of their mental health, like that first step. And no matter how many resources we have, no matter how easy we make it accessible, it seems like we cannot turn that dial to increase utilizations. And I think we need to get to them, directly. How does that impact you? And then have them be motivated that way. Regardless, I was just curious, what have you seen worked in terms of really resonating with people to change their actions?
Good question. Anyone want to take a stab at that? Any specific tactics in terms of getting people to engage?
So one thing that I think could be helpful in that space is to bring what you're describing kind of to the workplace in some sort of small group meeting or a meeting, and for people to have a space to share how they're feeling. Because you're right, a lot of people, for whether it's stigma or fear or some other logistics, have trouble taking the first step to engage in some of those resources. you know, another way to reach those people, though, is to normalize what's happening and bring it to the workspace and give them a space to share that, you know, how is everyone doing in terms of their mental health, and then provide, you know, provide again those resources. But sometimes for people that might be enough, just to know that there's a shared experience and that there's a safe place at work to discuss it.
Excellent. So what we're going to do, it's 10:23, and I'm going to give each of the panelists an opportunity, and I'm going to start with Lisa. Lisa, did you have something else you wanted to add before you do your final?
No, I was going to actually just share the very practical point that I think that in the healthcare profession, I dare say the mental health care profession, there's probably a different approach to that than I work with a lot of like lawyers and advocates, and sometimes they're very receptive to, you know, kind of resiliency training. And sometimes we just have to build it in a different way and say that, okay, we're gonna do some case updates, and then we're gonna learn about some new process. And then it's part of our conversation. But if I simply labeled the meeting, this is going to be a meeting about mindfulness, say, my staff just wouldn't show up. They would find something that they decided was more important. And so I think from a practical point of view, sometimes you have to look at your work culture and build things in so people start to feel more comfortable with that.
Great. So Lisa, would you like to just have your final words in regards to what you'd like to leave us with, our call to action, any last parting remarks?
Yeah, no, thank you for that. And again, thank you, Violet, for hosting this, and Anne Marie and Leadership Baltimore County. I really appreciate the ability to be here. And I want to again just remind you that Turnaround is your rape crisis domestic violence provider in Baltimore County, and I encourage you to support them. You know, being part of this panel is so interesting, and I think what it really reminds me is how much intersection there is, and how sometimes we really silo things that we shouldn't silo, that we're never really going to address all of these issues if we don't look at it in an interdisciplinary way. Because all of this is so important, that we have access to mental health care, that we think about mindfulness, that we have different platforms to receive those services. And yet, if we don't also address workforce, which also involves the pay gap between women and men, which also involves the underfunded nonprofit community, which includes actually hospitals as well as some of the more traditional nonprofits, like all of that has to be addressed at the same time. So I ask that everybody think about that, and instead of siloing your own lives and advocacy into, you know, this is healthcare, this is wellness, and this is my political activism, that really we think of that together. So today, for example, we've got the Time to Care Act on the floor of the Senate, and that's to provide paid family leave, which probably would benefit everyone, you know, on this call, because at some point we all need time to care, whether it's for our children or our parents or our loved ones, other loved ones. So my hope is that everyone on this call starts to think more about that intersectionality. And I would again just beg everyone, 3 things. In Annapolis, it makes the difference. When you guys make phone calls, I walk into those offices and they say, whoa, your people are calling me. So please be one of those women who is supporting other women. Thank you.
Fantastic. Thank you so much, Lisa. Dr. Gold?
Yeah, you know, I was just thinking, I'll just say this for a minute. Yesterday, there was a sign in my house when I was a little girl, and it said, "A woman's work is never done." And I had no idea what that meant. And I thought maybe there's typos or something, because I just do not understand what this sign means. And then I was thinking about that yesterday, and it's so true. And so, when one work is done, we shift to the other. And so So I think that we can't sustain that without taking care of ourselves. And so if you feel like it's too self-absorbed to take 10 minutes, 5 minutes to do X, Y, or Z, if you feel like you can't do it for yourself, do it for others that you're in contact with, because it makes you a better mother, caregiver, employee, whatever your role is. And so just think about that you're not only doing it for yourself, but you're giving back when you take care of yourself.
Fantastic. Thank you so much. Dr. Richards?
I think just to follow up on that, the other piece to remember is that you're not alone. I mean, the whole point of having this discussion is because, I see lots of heads nodding throughout when we give examples and that sort of thing. People understand when you're going through this, sometimes it feels like you're alone. And it makes you less likely to reach out to get the help that you need, but you're not alone. And you're allowed to, again, have bad days. You're allowed to not, the example I give sometimes is you're allowed to eat breakfast for dinner. I mean, do what you need to do sometimes to get through that day, to get sleep, to get rest, to reset. But just know that there's a lot of people that will help. It just takes, normalizing the conversation, which is the importance of what we've done today.
Excellent. Thank you so much. This was really, really outstanding. And I just want to thank each one of you. I want to thank the Leadership Baltimore County for putting this on. And I want to thank each of you for attending today. And I want to turn it back over to Amanda, who will close us out. Again, thank you, everyone.
Thank you so much, Dr. Gould, Dr. Richards, Ms. Jordan, and Ms. Apple. Thank you so very much for all of your knowledge and wisdom and taking the time to share that with all of us today. I echo all the chats and just saying how helpful this was. And I particularly want to say that normalizing this conversation, as Dr. Richards just said, is one of our most important tasks today. And so I want to thank all of you for opening up and sharing your thoughts and your questions with us. And we'd really like to continue this conversation online in a LinkedIn group. Now, this is a group that is for women and by women, meaning our panelists they may if they'd like, but there's no promise that they're joining this group. It's just about peer support, really. And so if you'd like to join this LinkedIn group, you can either scan the QR code and or connect with either myself or my colleague, Mary Kay Page, who also she's the assistant director here at Leadership Baltimore County, and we'd be happy to get you into that group. So let's continue this conversation and support each other. That's what we women do, and let's continue to do that. I'd also like to thank, before we leave, Patty Dash, who is the chair of LBC's Alumni Engagement Committee, and Anne-Marie Thornton, who actually put this entire thing together. So ladies, thank you so much, all of you. I really appreciate it. Thanks so much for joining us today, and let's stay in touch.
Excellent. Thank you, everyone. Have a great day.
You too.
Be in the moment.